And we're just looking at these studies and we're saying this is what we see that looks typical, this doesn't look typical. How does that relate to the behavior and the therapy in any particular individual? But yes, as imaging people, one of the things that imaging doctors do is you keep learning in terms of like this pattern usually associates with this clinic, that's other pattern usually associates with that. So we now know is that I can tell you in 100% of individuals who are on the autism spectrum, they have some excuse me, Michael? They have atypical, decreased function in their temporal lobes, and they have some decreased function, usually in the cerebellum. That's what that blue arrow is. So this is a typical pattern that's an atypical brain function image. Now, 15, 20 years ago, I see this is one of these progressive slides. But the simple point is that when the brain imaging, SPECT imaging's been around for 30 years or something, and when we were doing this imaging 10, 15 years ago, the concept at that time was something that's not working properly should be an area of decreased function in the brain. And so that's all we did is we looked at areas that were decreased, and we saw areas that had what seemed to be like increased function, but we didn't know what to do with that at that time, so we kind of ignored that. But we now have what's new is that we have a clue about what those things mean, the areas of overfunctioning, and I'll talk to you some more about that in just a couple of slides. So that on a slide, we now only have just the areas of decreased function, but on the right-hand side, areas that are color-coded in red. The usual concept is that if things are in the blue zone, which is not on this slide, they're decreased. Anything that's color-coded red or white is going to be increased function. So we've now making these maps of different parts of the brain. Here's a person who has some decreased function in their temporal lobes and a part of their frontal lobe or what have you, but the majority of dysfunction on this scan, the atypical aspect, is all those red zones. In other words, most of this person's brain is in the overactive category, not the underactive category. And I'll show you that what happens is that you cannot necessarily predict from looking at the behavior of a child in what category they are. And so our point is that until you actually look at the brain function and see whether it's under or overactive, you sort of don't know what might be an appropriate therapy to use. So in terms of findings, the majority of people who are scanned, on the majority of individuals on the spectrum have a combination of both increased and decreased activity areas. And the question really becomes in terms of making a decision about some management or therapy is, well, are we dealing primarily with an overactive brain or an underactive brain? And would we make different therapy decisions? The answer is yes, based upon primarily overactive or underactive. And yes, we're using a variety of color scales. I'm not trying to explain any of the color scaling systems to you. There's a lot of them out there. The majority of the slides that I show you, or if you ever see any scans from me, are in the color scale that's has the multiple colors. The point is that at least we have a color scale that I didn't design this, others worked on this over the years. In other words, we actually do know what is average brain blood flow, and that was determined over the last 30 to 40 years, and we incorporated that into the color scale that we use, such that when I talk to you about there's increased flow, increased function, the color scale, and the multicolor scale over there actually we know it has some physiologic meaning. Not all the color scales that are used on scan pictures actually have a known physiologic meaning. That's not bad, it's just something you need to know. I know some of you get scans out there, SPECT scans on individuals. They're sent to me and Dr. Henderson. And sometimes they're just scaled in some color scale that doesn't necessarily have any physiologic meaning. No wonder why people have some trouble interpreting these scans. And yes, we've transitioned from doing cross-sectional imaging. We can make three-dimensional pictures. Again, the point is not to show you a lot about imaging, just to know that because we have that whole volume of brain function, it's in the computer system, we can sort of slice it, dice it, analyze it. We can do quantitative analysis of it because it's digital data. These aren't just analog pictures. We really have 3D volumetric information of total brain regional function. And I've sort of already alluded to this, is that areas that are gray or blue are decreased function. Things that are color-coded in red or gold color are areas of increased function. Okay, so let's talk a little bit more. I've already covered some of this, and that is that we used to think about areas of decreased function as being the only thing that was meaningful. We now know that overactive areas are probably even more meaningful, or at least as meaningful. What's new is that we've actually been doing some correlations of this activity levels with people who are on the autism spectrum. And that has helped us to evaluate and find out and discover the comorbidity issues that are complicating the clinical management of somebody who's in the autism spectrum. So we're going to help you uncover things, and seizure disorder. You know, in many of these individuals now, there's good data to show that, at least in the children's part of the spectrum, is that there's a very high, like 50% incidence of some type of seizure behavior. I'm not saying that they have a seizure disorder. Many of these children don't manifest in any overt seizure behavior. But the point I want to get across over here is that just think of what it's like for the individual who's in the spectrum, who's trying to understand and function in life. And if you got some part of your brain that's just running on too fast, even if it's not provoking a seizure, it's like a light that's going on over there, and it's probably not a helpful thing. And even as Dr. Herbert was saying, is that some of the times these, or not some of the time, probably most of the time, these individuals actually are, their brain is struggling, like, how do you manage all of this data, and how your behavior is if parts of your brain are going too fast and other parts are not going fast enough. So we're looking at making these observations, saying, well, what would the therapy be to help minimize these factors that are complicating the clinical management? And so when I talk with doctors who refer patients for scans, I'm really telling them about what else is going on so we can help them to manage that while they're trying to deal with the dysbiosis issue or the behavior issue or what have you. Is that clear? Okay. So here's an example of that. Well, the take-home message here, you don't need to read all this, but the take-home message is very simple. And this is on one of the handouts that we have in our booth. It's basically the same clinical presentation. These kids had about the same behavior with obsessive behavior, odd play, difficulty with speech or what have you. Hey, look at this. One child has got, so you know right now, things that are blue, that's decreased function. If it's red or white, it's increased function. Similar clinical behavior pattern. One child has got areas of the brain that are primarily decreased function. Another area has primarily increased function. Maybe that could give you a clue, and in point of fact, it does give you a clue as to what might be the next thing to do in terms of therapy.